Welcome to Adapting Class. So today we're going to deal with the case study on ethics. This is an area that it can be very intimidating and difficult, but in a very straightforward way, I will give you all the key aspects of ethics. So what do we have? We have a patient who is 79-year-old. Patient has Alzheimer's, early onset of Alzheimer's. Pay attention. And then dehydration and altered mental status. Does that ring a bell in your ear? It should be ringing right now. Patient has history of hypertension and hyperlipidemia. This is the case being presented, right? No advanced directives on file. No activated healthcare proxy. That should be your clue. We're dealing with ethical situation. Patient is full code. So I'm summarizing the case. A 79-year-old has Alzheimer's, dehydration, altered mental status. He has a history of hypertension and hyperlipidemia. No advanced directives that we have on file. And the patient has no healthcare proxy, but recommended a full code. Family is estranged. There's no sign available in the state and not listed as emergency. So we have a problem here. So this is the first case. And as we progress through the case, this is some of the assessment the nurse was able to find based on what the patient presented with. The client was admitted, like I said, with IV fluid therapy due to dehydration. He became intermittently disoriented. Remember, patient has Alzheimer's disease, now intermittently disoriented, but is oriented at times to person in place. So back and forth, consistent with the disease process of what? Alzheimer's disease. Pay attention to that idea. He's calm, but he refuses to have his IV restarted, right? Because he keep on pulling on his IV. The IV came out, and the nurse wanted to restart IV after it infiltrated, right? He said, leave me alone. Ethical case. This is a case study on ethics on a patient who has Alzheimer's. So these are the little things when you read, these are buzzwords as you go through, you got to put yourself in that situation. I don't want any more needles. I want to go home. Alzheimer's patient telling you, leave me alone. I want to go home after the IV infiltrate. He tries to remove hospital monitoring equipment and say, you can't keep me here. You want to leave. Does that ring a bell? Have you seen that situation before? Have you find yourself in that situation in case patient like that? Now, you've saw the case. Now, what do you think is going on? What would you do now? What are you going to do? These are the orders the doctor gave it to the nurse. Then the doctor doesn't care. He said, IV reinitiated ×1. That's the order. He does not care whether the patient is refusing. He said, you got to place the more IV because we need to hydrate the patient, right? And continue IV fluid because the patient is dehydrated. The nurse, this is what the nurse said. Client with the growing agitation. Remember, you want to go home. Just let me know what you're thinking right now in your head as you read this case. Put down in the comments and let me know what you're thinking right now. If you are in that situation, what would you do? The nurse asked the charge nurse if restraint can be applied for safety. Remember, patient said he want to go home. The doctor said reinsert the IV. You see the situation you find yourself in. These are ethical dilemma. NCLEX would test you. Nursing school would test you that situation. Patient has Alzheimer's, is 79, admitted with what? Dehydration, IV infiltrated. We want to reinsert another IV. Patient said, I want to go home. The doctor said, well, insert another IV and give him fluid. The nurse is confused. He said, well, I need to go to the charge nurse and ask for what? If I can restrain the patient. Now, this is your first question. Which cues should the nurse recognize as ethically and legally significant? Based on the situation, what do you think? Client refuses IV reinsertion. Is this ethical and legally significant? No activated what? Healthcare proxy. Does that bother your situation? How you're going to manage the patient? If you know, you can put it down in the comments. Patient is full code status. Is this an ethical and legally significant situation based on the case? And then patient has history of Alzheimer's disease. Finally, and straits are not listed as an emergency contact. Think about it. What do you think? Which of these things affect the whole overall management of the patient? Number one, the patient refuses. If he refuses IV, is a problem. That's number one. So that's the first thing we have to worry about. He refused IV. This is an ethical issue you got to deal with. At the same time, there's no healthcare proxy. Nobody has to make that decision. This is also a problem. Being a full code status does not affect your ethical problem. And the fourth one, if you have Alzheimer's, you got to worry about him making a decision. That's a problem, right? And then the son is not available. This is a problem, right? There's no emergency contact. If something happened to the patient, what are we going to do? So those are your right answer, right? Those are this and that. Being a full code is not a problem. But 1, 2, 4, and 5 are an ethical situation you have to deal with in this situation. So those are the first thing the NCLEX will ask you. And then the client is intermittently what? Oriented. You go back and forth. Intermittently oriented is a good idea, right? Is very good. It can make a decision. So it's not completely challenging. Now, what do you want to do? Based on the client presentation, match the cue to the correct ethical and legal principle involved now. You remember the case. Now we're going to figure out if this is the principle. There's ethical principles NCLEX will ask you. There's a bunch of them, but you have to know how to apply them. Which situation is okay? Refusal of treatment. Is it a beneficence? Is it a decision-making capacity? Is it an autonomy or surrogate decision-making? That's the principle. No healthcare proxy. What kind of principle is that? Alzheimer's disease. What kind of principle is that? And full code status. What do you think is the principle? What do you think is the principle being demonstrated here? You can put it in the question in the comment section, but think about it. If I have a refusal of treatment, what is the patient doing? I don't think it's beneficent, right? It's not that, right? You are not doing good harm or anything to the patient. It has nothing to do with the decision making. What do you think? This is an autonomy that the patient is demonstrating, telling you, I can make my own decision so I can leave. The lack of what? No healthcare proxy. Yeah, that make a surrogate decision very difficult. There's no surrogate to make a decision, right? What do you think about diagnosis of Alzheimer's and the full code? It's between beneficence and our decision-making capacity. What do you think? How does that relate to that? The idea of patient having Alzheimer's disease should trigger you that he may lack capacity, right? He went back and forth. He went back and forth in terms of his concentration, sometimes AO times 2 or 3, right? So Alzheimer's disease diagnosis affect capacity. Your decision-making capacity can be alternating. And the full code status is about beneficence. We got to know so that we cannot do any harm to you. We got to make sure we can provide every healthcare providing information to you. So this can be something that NCLEX will trap you, but you have to know diagnosis of Alzheimer's affect decision-making capacity. The presence of a full code is related to what? Beneficence. And then no healthcare proxy is decision-making on terms of surrogate. And the refusal is an autonomy. So the patient is demonstrating some principles that we also have to be familiar with. What is the next priority concern? If you are in that situation and you're taking care of this patient who has Alzheimer's, dehydrated, IV infiltrated, we need to put him in more IV. But the patient said, I want to go home. Ethical dilemma. What would you do? What is your decision? The client will become combated and injure staff. Is this what the nurse is worried about? The client lacks the capacity to refuse care. Is this what the nurse should prioritize? The client is at risk for fluid volume deficit. Is this what she should prioritize in this situation? The provider may withdraw care against the client's will. Go back to the case. I always say, go back to the case. There's a key fact. It's an Alzheimer's patient, dehydrated, IV infiltrated. We need to give more IV. What should the nurse prioritize? And the patient said, I want to go home. If I want to go home, don't put the needle in me anymore. What should be the next priority? She's worried that this Alzheimer's patient will go and hit somebody, or the patient cannot make a decision at this point regarding his care, and then whether the patient will at risk of fluid volume deficit or withdrawal of care by the provider. Something should tell you, we have a patient who need help and he's refusing. Don't get trapped with the fluid status. At this point, the fluid status is no more important. You have to make sure he understands what he's talking about. If you just focus on the fluid status, is wrong. Focus on the fact that he cannot make a decision at this point. So the best answer is the refusal. The lack of capacity is a problem. The client lack of capacity to refuse care make the whole thing complicated. So you need a legal or ethical decision has to be made based on capacity, not diagnosis. We have to make ethical, legal decision based on capacity. He lack capacity. He trump the presence of what? Fluid deficit. I'm not worried about it. I'm not worried about him injury patient. He's 79-year-old. Who cares? I'm not worried about the doctor providing any care. But the most important thing, can we treat this patient who want to go home? So, number two, always focus on the most important thing regarding the situation. He said, I want to go home. His fluid status doesn't matter anymore. If he never said anything about it from the beginning, yes, his fluid status matter. But now he said, don't touch me. Don't put any more needles in me. Go to your ethical background now and say, I cannot touch this patient anymore. Otherwise, I go to jail. So two is the right answer. The client lacks the capacity to refuse care at this time. We have to investigate. Now, what is the next best immediate response to the client refusal? Now we know he doesn't want IV, he doesn't want IV fluid. So what should you do? Right? What should you do? I give you a clue. Notify the provider that the client refuses and document it as AMA is leaving. Reorient the client and reattend IV access with the second nurse. I'm trying to trick you, okay? Because that's what the NCLEX will do to you. When it comes to ethical questions, all the answers are right, but focus on the buzzword, the client refusal of IV therapy. Assess and document the client decision-making capacity at this time. I give you a clue in the previous answer trace. Apply restraint and attempt to start IV to prevent the deterioration. I can tell you, number 4 is wrong. You should never put the restraint. The patient said, no, don't touch me. Even if he does not have capacity, don't restrain them and start IV by force, right? Notify the healthcare provider and that the client refuses. You are not helping. You are not acting as an advocate. You are not doing your job at this point. You said you just washing your hands. It's okay. You want to go. The last question said, find out what is the priority is what? Assess the client capacity. Therefore, the next priority that you should address is what? Assess them and document their decision making and tell yourself, this patient can make a decision. And so the decision he made is okay. He can go home. Every time you see a question about patient refusing therapy and wanting to leave, I want you to pick an answer Asking for what? Decision-making capacity. Is what the patient asking, is it appropriate? Can they make that decision? And that decision, do they have capacity? The key word is capacity is specific. You always want to assess capacity every time. It's not what it was yesterday. Even if it's confused yesterday, today is not confused. Assess its capacity. So capacity in legality, this is a legal lecture I'm giving you. Capacity in terms of legal situation is time specific. Today, they can be 100%. They know what they're talking about. They are AO times 4. They know the president. They know their name. They know what is going on. So you have to assess their capacity. And at this point, that is the key. Don't worry about them delivering AMA. You are not helping them. Don't bring another nurse to reattempt. You got to make sure they know what they're talking about. Assess their decision-making capacity at this time. And of course, don't reattempt to insert it by restraining them. So check their capacity again. Assess them. Number 3, I'm trying to let you focus on that. That principle, if you know it, ethical question will mix you if you know this decision when it comes to decision making. What actions are legally appropriate at this time now? So what should the next do now? I give you metrics, right? What action? Is it appropriate or not? Document the client exact words and behavior. Do you think it's an appropriate thing to do? Contact the hospital ethics committee for guidance. Should you do that? He refuses. You think he may have capacity. You got to assess that. Call the estranged son for consent. His son that is estranged. He doesn't even know his father. And you want to call him to start the IV to give you consent. Evaluate the client orientation. I'm going down to the capacity again. Evaluate the client ability to understand consequences. I'm going back to capacity again. Proceed with IV therapy under implied consent. These are all traps. Concept here is focus on capacity. And what do you want to do? What do you want to do? Which one is appropriate? Document the client exact word and behavior. This is what we do all the time as a nurse. Whatever the client say is perfect. So you need to document it. This is what he's saying. He said, I want you to go. Don't touch me. Don't do anything. That's the first thing. We have a situation, we got to call the ethics committee to come and guide us because the patient refuses. You shouldn't call and strain son. It's not part of him. He doesn't even know anything. This, you have to evaluate his orientation. Orientation means what is he alert? Is oriented? He know what he is. He know what he's doing. And then we have to evaluate his understanding of the consequences. Trust me, when you see this question of a patient leaving, always go back to capacity. You want to leave, you have a heart attack, we got to do what? EKG. And you said, don't do that, I want to leave. You cannot say, okay, call the doctor and sign AMA and leave. Always assess capacity. 4 and 5 are saying the same thing. Orientation and understanding the consequences is assessing the orientation. So 4 and 5, you got to do. Proceed with IV therapy under implied consent. Implied consent is not used if the patient is oriented. So you should not do that. So this is not acceptable. So that's what, if they give you a table like that, this is what you should be looking for. Okay? So these are ethical questions. It can be difficult. It can be annoying. But if you stick your ground, you get all of them right. Match each outcome with a correct category. Now, I just give you a bunch of outcomes. Clients remain hydrated. Clients restrained to reinserted IV despite refusal. Documentation include client words and rationale. Provider override and initiate IV therapy. Positive outcome, right? Then require ethical review and possible autonomy violation. Therefore, this is the outcome, okay? What do you think it means? If the client remain hydrated orally and oriented times 3, Is it legally sound action? Is it a positive outcome? Does that require ethical review? Is it a possible autonomy violation? That's what it means. Client restrained to reinsert IV despite refusal. That means we restrain the client and place IV. What are we doing? Does this require it violate client autonomy? Does it require ethical review? Is that a positive outcome? And does that require legally sound action? Same thing. If your documentation include client words and rationale, or provider override and initiate IV therapy, what do you think it means? You got to match them. I can tell you that based on that, if the client is hydrated, hey, that's why we started the whole thing. If you hydrated, right, what have we done? If you hydrated, I think we have a positive outcome. That's a good idea. We have achieved a positive outcome. If you restrain the client and you reset IV, what have you done? If you restrain these clients and you set IV, you will have a problem. It's not a legally sound action. Does that require ethical review? Is it a possible autonomy violation? What do you think? Patient refuse and you reinsert the IV. That's ethical review. We need to review this again. We have a problem. You violated the client autonomy and you need ethical review. Documentation include client words and what? Rationale. This is a legally sound. So the nurse is protecting herself. He documents what the patient is saying. So this is a legally sound action. Provider overrides and initiate IV therapy. You know you violated the client autonomy. He said, don't touch me. And you touch me. And therefore, that is the problem. I want you to master these ideas, these words, you may see it. There's some situation that require ethical review. There's some that violate patient autonomy. And overriding is desire and inserting the IV, you violate the autonomy. And if you restrain them, it requires ethical review. This is a problem. And these are ethical questions, fundamentals of nursing, case study, using these principles to show you how you can master your fundamentals, even when you see it in a case. But this is a fundamental of nursing with dealing with questions and answers in a case study form, next generation, to be able to see what is going on. Number 7, which statement from the nurse note suggests potential violation of client's right? Now that you know what are ethical violations, what do you think? Client is confused at times, but understand names in place. Is that a violation of client's right? What do you think? You can put that in the comment. Client state, I want to go home. Don't touch me. Is this suggest potential violation of client right? That's what the nurse is doing. Client restrained to prevent removal of IV without consent. The nurse did that. It restrained the patient so that it doesn't remove the IV. There was no consent. Do you think this is a violation of client's right? IV reattempted while client was distracted. We distracted the client by another staff. Do you think this is a violation of client's right? You may have heard this before, you have seen this before, but this is our ethical principle I put in the case for fundamentals of nursing, NCLEX fundamental review. Family not reachable, right? So the nurse proceeded with the therapy. There is no family, and I did this. Which of these situations should concern you? And if it concerns you, what fundamentals of ethics do you think we have violated in terms of the patient right? You have 5 answer choice. Which of this? Which of this? What do you think? Family not reachable is a problem. If the family is not reachable, and if you proceed with therapy, that's a problem. So if you reattempted the IV by distracting the client, that's a problem too. You shouldn't do that. He said, don't touch me. You restrain the client without the consent and you place the IV, that's a problem. This is what the next document. The client confused at times, but understand name and place. That's what he said, AO times 2. So that's a good. It doesn't violate the client problem. So she said that. The next document, don't touch me. So that's fine. All this does not violate the client's rule, and that's that's not the problem. So 3, 4, and 5 are bad stuff that the nurse did that violate the client's rule. Which of the following are appropriate alternative to resolving the ethical dilemma? There is an ethical dilemma. What was the ethical dilemma? Patient need IV. He's dehydrated. Patient want to go home. He said, don't touch me. The nurse is now confused. The nurse wanted to talk to what? The charge nurse, because she received an order from the provider. He said, reinsert the IV and give the patient fluid. We have an ethical dilemma. Ethical dilemma is a confusion between a situation where the nurse does not know what to do. Does she insert the IV without the patient consent and infused, or what should you do? This is a problem. So an ethical dilemma, what would the nurse do? First thing, offer oral hydration and monitor closely. Remember, patient refused IV. He want to go home, but he's dehydrated. He has Alzheimer's disease. The doctor said insert IV. The nurse want to talk to the charge nurse. Okay, what do? I have ethical dilemma. I'm confused. Should I offer oral fluid that will hydrate the patient? What do you think? If you are the nurse in this situation, is that a good thing to do? Refer to the hospital ethics consult and risk management so that they can help you with your ethical dilemma that you're having, because the charge nurse cannot help. The doctor said insert IV. Will you talk to the ethics committee? Wait until client is fully disoriented. You have to wait how long and then proceed with IV. He said he want to go home. He's pulling IV. How long can you wait? Place the client under involuntary treatment hold. Hey, he came in. You want to put him involuntary treatment? You know what involuntary treatment means? Maybe it means you are basically admitting somebody who you think you worry about, and you basically, without their will, they have no autonomy, they have nothing. You just admit them, and after that, you can accept the autonomy. So somebody like schizophrenia is dehydrated, is confused, is suicidal. You can admit them involuntarily without their will, but after that, they have autonomy. They can refuse care. This nurse is saying, well, admit them anyway, under involuntary treatment hold. I don't know about that. Have the charge nurse assess capacity in real time. The nurse said, assess capacity. We saw capacity already. And you know, whenever you see capacity, it's a good thing. Number 5 is a good thing because capacity changes with time. Therefore, 5 is a good thing. I will give the patient oral hydration. Hey, if you refuse IV, well, why don't you drink to hydrate yourself so that you don't get sick? That's a good thing, right? So refer to the hospital ethics consult or risk management. They may help you. They deal with this. That's good. You cannot wait until the patient is oriented. That's like really not, I mean, fully disoriented. That's unacceptable, right? So that they don't know, and then you can insect it or admit them involuntary. So based on that, we can say 1, 2, and 5 are a better choice for the nurse to follow in this ethical dilemma. Whenever you have a situation like that, consult the risk management team or give them non-invasive, and always assess for capacity. Never leave capacity alone. And number 9, match each action to the correct category based on whether it reflects advocacy or what? Autonomy or safety. So you have like 8 information here. Which of these indicate advocacy, autonomy, or safety? Offering fluid, PO, and monitoring output. What is the nurse doing? Protecting the client from forced IV. What is the nurse doing? Because that's what the doctor said. Educating client about dehydration consequences. What is the nurse doing? Reaching out to the ethics board. What is the nurse doing? Is the nurse acting as advocate? Is the nurse ensuring patient autonomy is improving? And there's the nurse providing safety. What do you think? This is a straightforward question, and this is testing your knowledge on what the nurse is doing. I can tell you, if I'm protecting the client from forced IV, I'm ensuring that he has autonomy because he refused it, right? If I'm giving you IV fluid and monitoring your urine output, right? What do you think I'm doing? Offering fluid and monitoring. What do you think? I'm providing safety to you. I don't want you to get injured or anything like that. Educating the client about consequences and reaching out to the ethics committee. These are all advocacy. You're acting as a nurse. Advocacy is basically educating them and then reaching other committee to help with the situation. When you're protecting them from forced IV, you're ensuring they're having their autonomy, and then offering fluid and monitoring them is providing safety. You don't want them to get injured. This case is called Ethical Principles, Fundamentals of Nursing to help you in nursing school and the NCLEX. And the last question, I know you can haste this. Let's get to it. Which finding indicate that the nurse action uphold ethical and legal nursing standard? We finally wrap in everything. The nurse did a good job. How do we know? Well, client refusal was respected and documented clearly. Of course, that means the nurse is advocating for the patient, and that ethical and legal principle was held, right? Client's son was forced to make a decision over the phone. We call the estranged son and let him make a decision. The nurse involved the ethics committee before proceeding with the IV, and they told her what to do. The client remained stable and was discharged with oral hydration. The nurse physically blocked the client from leaving the bed. This is principles of ethics. I'm using all the things that you know about ethics and legality. I put it in the case form to help you with the fundamentals. If you watch this video, you go through the case, you can see when they ask you questions, come back to this. What do you think? Which is for upholding ethical and legal nursing standard? This can be a long lecture, but this is what you think. What do you think? The client refusal was respected and documented, right? It was refusal was respected, right? What does the nurse do? And document what the patient is saying. I think that's a good thing. The nurse is upholding ethical principle. That's what she's doing, right? The son was forced to make a decision. That's a bad thing. He's an estranged son. He has nothing to do with the father. The nurse involved the ethical committee to help with the situation. That's a good. She's upholding, he or she is upholding ethical and legal standard. The client remained stable and was discharged on oral rehydration instead of forcing IV on the client. That's also a good thing. Blocking the patient's seclusion or restraining the client is not good. This is Adapting class. I hope you learned some ethics and principles of legality in these fundamental case study questions and answers. Thank you for watching and good luck. If you need more, check Adapting class. I have a bunch of ethical principle video that you can watch to help you understand these ethical violations that need to be done. Whenever they have ethical review means the ethics committee will come and review the situation, figure out if you violate the client autonomy or what you did wrong. Thank you for watching and good luck in your exams.